of my study was to assess the prostate cancer knowledge and misconceptions among Haitian men. I'm often asked, why did I choose Haitian men? And I simply state, because of the fact that I am a Haitian American woman, I wanted to do something that would positively benefit my community. So, similar to other black men, Haitian men are at risk for developing prostate cancer. So it is important that we understand these men's knowledge and beliefs about prostate cancer so that we can better educate them about risk reduction and early detection behaviors. So let's examine the statistics. 1 in 5 black men will develop prostate cancer, and it is estimated by the American Cancer Society that in 2013, 35,430 new cases of prostate cancer will occur within black men. Black men are not only at higher risk for developing prostate cancer, but they are also at a higher risk of developing a more aggressive form of the cancer, and they also have a higher mortality rate. The current cause for this health disparity is still unknown, but there is assumptions that genetics, hormonal factors, and dietary habits can be due to this health disparity. But the only known risk factors are age, race, and family history. Living in Haiti versus living in America. 48% of all cancers diagnosed in Haiti among Haitian men in Haiti is prostate cancer. And this is a very high percentage. A lot of the men in Haiti are expected to live up until the age of about 61 years old. So a lot of the times they end up dying before they even really get a chance to pass from prostate cancer exactly. And also these men, when they pass away at an earlier time, other men in the community don't really get to understand the impact of prostate cancer and how important it is to get screened earlier. So when you look at men living in America, 37% of all cancers diagnosed among men is prostate cancer. And these men also have a longer life expectancy. And even though we live in America, a lot of these men still continue to not participate in screening activities. So what's the issue? Why are these men not getting screened? Well, it can be said that denial has something to do with this. A lot of the men just feel as though they're not susceptible to this disease. They can also have a lack of knowledge, superstitions and myths, views on sexuality and DREs linked to homosexuality, a lack of trust with the medical system, and fear of a positive diagnosis. So the goal of my study was to reduce the burden. The long-term goal of my study is to reduce the burden of prostate cancer among Haitian men. My study objective was to explore prostate cancer knowledge, myths and misconceptions among Haitian men. And I plan to, in the future, hopefully get my study published, and then I hope to go on to medical school and become a physician. So my study answered 3 questions. The first question is, what is the level of prostate cancer knowledge among Haitian men? By a show of hands, how many of you feel as though it's going to be low? How many think it's going to be high? Okay, we'll see what's going to happen. The second question is, what are the common myths and misconceptions associated with prostate cancer among men? And third, which demographic factors are associated with prostate cancer knowledge, myths, and misconceptions? So why is my study significant? It's significant because it's focusing on an understudied group of people. When I did my literature review, I noticed that it really wasn't a lot of information about Haitian men specifically. And it really wasn't nothing that focused on knowledge, myths, and misconceptions. So it's important that when we categorize black men, we break it down into not just black men, but also their cultural background. Because if you understand someone's culture, you can understand their lifestyle and how to better educate them about a disease. So the process for completing this study involved an IRB. And after I got my IRB approved, I then went on to 3 different sites, 2 in Miami, 1 in Orlando, to collect my data. So to participate in my study, you had to be a Haitian male between the ages of 40 and 70 and English speaking. So during data collection, I gave the men free t-shirts as incentives, and these surveys were self-administered. So after that, I then had to go into Excel and take each survey one by one and put in all the information that I found. From there, me and my team member, the guy here in purple, Ezekiel, he helped me with my data analysis portion of my project. So now we can look at the results. Out of 100 surveys, I had 95 men complete my study. And the demographics showed that men between the ages of 40 and 49 participated by 40%, which is good because it's recommended that black men get screened at the age of 40. A lot of these men had a college degree, were married, and had a full-time job. Now, the results also showed that more than half of these men had insurance, they had an annual physical exam, and they also had a regular doctor. And these numbers are higher than what I even hypothesized them to be. And it showed that these Haitian men were very into their health. It showed that they were willing to really go out and see a physician. And these numbers are even higher than the numbers for black men. So the results survey also showed that although about 50% of these men are recommended to have a DRE and a PSA done within the last year, only about a quarter of the men actually went through with getting screened. So back to question 1. What is the level of prostate cancer knowledge among Haitian men? On a scale of 1 to 10, the mean score was a 5. So for those of you who thought that knowledge was low, got it correct. Question 2. What are the common myths and misconceptions associated with prostate cancer among Haitian men? And the mean for that was a 2.7. And that's, although it's a low number, it's a good number because it shows that myths and misconceptions are low within this population. When we look at the knowledge survey, we found 5 areas where the men were very knowledgeable and they really understood that prostate cancer was a most common disease within men. And these areas are areas that we don't really have to worry about improving knowledge in. Whereas for these questions in red are where we need to focus more on, and we need to target these men and figure out ways to improve their knowledge in these areas to better help them get screening annually and to better help them understand how important it is to their health. For the myth survey, I found 3 myths that were high, and myths often help people to determine what type of behaviors they're going to have when looking at health. So, for example, these men really were worried about their manhood, and they were worried that prostate cancer would be a threat to their manhood. So they were really worried about treatment and how it was going to affect incontinence and incontinence within them. And they were also worried about the chance of taking away their manhood. And also, these men also had an understanding that prostate cancer was common, but they did not realize how serious it was with men dying from it. So with question number 3, we can say that demographics, factors that affect knowledge are education, income, and insurance. And for myths and misconceptions, education, employment, income, and having a regular doctor are factors that affect that. And the minuses you see here are basically indicating that if you have a higher education, your chances of believing the myths and misconceptions are lower. So the minuses mean a lower response. So although this was a self-report, although this was a self-report, it had limitations that these men, we have to assume that their answers were honest. And the findings from my survey cannot be generalized to the whole Haitian population because it was a small sample size of just 95 men. And we cannot use men who did not speak English. So Creole-speaking men were not able to participate in my survey. But even though that we had limitations, we still found a good amount of information for this population. So in conclusion, this is the first study to explore prostate cancer within Haitian men. And it showed that there is a low prostate cancer knowledge within this Haitian population, and also myths and misconceptions are low. While here at ReTOOL, I really learned a lot, and I really want to thank Dr. Odedna. I really couldn't have made it this far without her. She taught me how to develop a research study, how to go about doing an IRB, how to just understand the importance of hard work. And collecting primary data is a lot of hard work involved in that. And I really thank her so much for everything she's done, as well as the ReTOOL staff. From Dr. Reams, Dr. Odedna, Ms. Pressey, the mentees, my team. These are my references.